Hi, I'm Doug Allred. Welcome to the Greensboro Coliseum, where a free dental clinic is underway. In this month's Code View, we'll tell you about the state of nursing across Cone Health, reintroduce you to an old friend who really doesn't get along very well with germs, and meet one of the driving forces behind this dental clinic. Not surprisingly, she's a Cone Health employee who is also this year's Woman of the Year. Many of us use this time of year to recap the past year. Chief Nursing Officer Teresa Broderick is doing that with her annual State of Nursing addresses across Cone Health. Broderick says 2012 has been a terrific year for nursing.
The fact that we have 3 nurses who just received their doctorate in nursing practice, 1 who just received her PhD, the fact that we have 24 published articles and books that go across the country and support evidence-based practice is just remarkable. And the fact that it comes all out of one health system is beautiful.
Broderick is also proud that 111 Cone Health nurses achieved a national certification and that a record 23 Cone Health nurses are among the Great 100. State of Nursing sessions will be held December 4th in the Cone Health Heart and Vascular Center, December 17th in the Womankind Center of Annie Penn Hospital, and December 20th in the gymnasium of Cone Health Behavioral Health Hospital. All sessions start at noon, and those meetings are for anyone wanting to learn about the accomplishments of Cone Health nurses. Nurses played a very important role in Cone Health's latest award, the Organ Donation Award. Cone Health received its first silver medal recognizing efforts to ensure that an organ donor's last wish is carried out.
When a patient becomes a donor, they become one-on-one with the nurse. The nurse can't really take care of any of the patients. Caroline, a donor, gets involved, and they're behind the scenes, looking at lab results, looking at vital signs and all those things. And the nurse, the job of the nurse really is to keep that patient's organs perfusing as best as she can.
The award was presented at the National Organ Donation Congress. The medal will rotate to all Cone Health departments that cared for donor patients during the past year. Leila Moore never slows down. Moore developed the Cone Health Congregational Nursing Program and helped put together the HOPES program. We caught up with her at the Greensboro Coliseum, helping to bring a recent free dental clinic to the area. The clinic served 811 people. For all of this and more, she was named the News and Records 2013 Woman of the Year.
Women have power, and when I was young, I did not think I had a voice. What I have learned with age and tenacity, perhaps, is that we all can make a difference. You need to find what your passion is and put your heart into that. We can all make a difference.
Moore considers herself blessed in that her job with Cone Health is also her passion.
Just splish it around between your palms, like this.
We all know that the simple act of washing our hands is one of the easiest ways to stop the spread of germs. Dr. Germoutski knows that too, and the Harper of Hand Hygiene has a new video and awareness campaign reminding patients and visitors to clean their hands. Look for him everywhere.
In the patient rooms, on the television, for our community visitors, families, patients to watch, along with staff. It'll also be available on the intranet homepage. We're looking at ways to make this available for our physician practices so they can also share this video with their patients.
You can see more of his video at the end of Code View. Expect livelier karaoke nights at Cone Health Behavioral Health Hospital thanks to the Pay It Forward program. Thursday karaoke nights are a favorite for patients and staff alike, but the music was more attuned to a senior center than here. Donna Overby is changing that. She originally selected an outside organization for her golden ticket $1,000, but decided that charity does indeed begin at home.
We have karaoke night, and this is something the patients have a lot of fun with. It's something I can actually come and see the impact it has on patient care. So that's why I decided.
There are 11 other golden ticket recipients working on projects in the Pay It Forward program. It doesn't take $1,000 to make a difference in our community. You can do it with a child's toy. The annual Santa Link Toy Collection Drive by CareLink stops on December 7th at Moses Cone Hospital, Annie Penn Hospital, and Women's Hospital. A CareLink crew and Santa collect at Wesley Long Hospital, Behavioral Health Hospital, and MedCenter High Point on December 10th.
You should see the faces on the agencies on the delivery day when the toys are delivered. They're excited about it, and just the joy and the spirit of Christmas that we're able to give to those families. It's wonderful.
Your donation of new unwrapped toys goes to children at Kids Path of Guilford County, Help Incorporated of Rockingham County, the Free Clinic of Reedsville, and other agencies in Guilford and Rockingham counties. Another Subway restaurant has come to Cone Health. The first opened at Moses Cone Hospital. This one is at Wesley Long Hospital, where it is already a hit among employees.
It is awesome. I love it.
How come?
They have very healthy choices.
I think it's wonderful. Gives us different options outside of the cafeteria food. They're open later, so it accommodates the night shift.
Well, it's good, healthy food. It's fresh.
The addition of the Subway brings a name brand option to hospital visitors. That's it for this edition of Code View. As you prepare to embark on holiday gatherings, we leave you with a bit of advice from Dr. Germoutski.
Hello, patients and visitors and anybody else who happens to be watching. Welcome to Cone Health, known from here to Jupiter as the network for exceptional care. I am Dr. Germoutski, man of science. We want you to partner with Cone Health to stop the spread of germs and keep you safe. Germs are absolutely everywhere. They're here, and here, and here, and here, and even here. We can start getting rid of them by getting them off our hands. Oh yes, they are there. How can we get rid of them? I'm glad I asked. Allow me to demonstrate. If you look around, it won't be long before you see one of these dispensers. That's your cue to wash hands and save lives. Simply press this lever and look. This disinfectant foam is germs' worst nightmare. Just splish it around between your palms, like this. Then you want to get it between your fingers, so you put one hand over the other, like this. Then back over, palm to palm, with fingers interlaced. Now it's thumb time. Rotate it this way. Rotate it that way. And finally, focus on the palm area. By the time you get to this step, you should have spent 20 to 30 seconds washing your hands. Yep, you got it. Now this foam stuff, you don't want to rinse it off. Once it's dry, you're finished. And the germs are now former germs. But let's say your hands are visibly dirty and you really need to wash them. You'll find this other kind of dispenser near sinks throughout the building. Same basic scrub method with your hands, just wet your hands before applying soap. Wash for 40 to 60 seconds, and at the end you rinse with water, dry with paper towel, and turn off the faucet with a new towel. When your hands are dry, you've done what needs to be done. Now it's time to get everyone else who may be handling things to do the same. Patients, visitors, doctors, nurses, mailmen, presidents, I don't care who they are. If we all work together, the germs are going to have a very bad time. And that's good. I'm Dr. Germoutski saying, see you next time.